Now we're going to see Mullerian agenesia, also called Meyer, Rokitansky, Kuster, Hauser syndrome. Here, let's remind ourselves what are the Mullerian derivatives in the female. These are the uterus, cervix, fallopian tubes, and the proximal vagina. So, the uterus, let me try to draw an uterus, well, something like this. Uterus, the fallopian tubes, the cervix, and the proximal vagina. So, if the patient has Mullerian agenesia, there would be no one of these developments. So, the patient is a 46XX. The ovaries are right, they are completely normal. So, there are also estrogens that are produced by the ovaries because the problem is not on the ovary. So the patient will have the secondary sexual characteristics that are produced by or that are the result of estrogen, but they would not have the uterus. So here you could say like breast, yes, but uterus, no. Here the important issue would be a patient with primary amenorrhea, maybe with pain, something like that, and this is the diagnosis. These patients can become pregnant, but they will need a in vitro fertilization surrogate. This is the ovum can come from, or the egg can come from this patient, but the patient has no uterus to carry the pregnancy. So this egg should be injected into a mother surrogate, and she will carry the pregnancy, and then the baby will be born, and then this patient will have it. The issue is that this patient has no uterus to carry the pregnancy. The treatment is just the enlargement, surgical enlargement of the vagina, maybe some dilators of the vagina to decrease the pain. Also remember that uterus, vagina developments are also associated with kidney development. So the patient also can have problems with kidneys, like just one kidney, or recurrent urinary tract infections, things like that. So here, also the patient will have axillary and pubic hair because the estrogens are completely normal. So the patient has the triad of primary amenorrhea plus axillary and pubic hair plus breast, yes, uterus, no. And this is Mullerian agenesia.